Hi, I'm Dr. Shabnam Daskar. I'm a functional medicine specialist. Welcome to this episode of PCOS Clarity. PCOS and mental health challenges are very common. Today, I'll just briefly discuss why is that so, and more importantly, what are some of the things you can do about it. Um, So why do women with PCOS have more anxiety and depression than women without PCOS? It has been found that a lot of women who have PCOS, now PCOS, as if you have that condition, you know that this is a condition, one of the commonest hormonal abnormalities seen in women. And sometimes the problems can start when you're very young, right through adolescence and early adulthood, right up to even actually in the postmenopausal period. However, one of the commonest problems with PCOS is infertility, so difficulty in having children, getting pregnant. And PCOS is essentially a very complex genetic, metabolic, environmental interaction problem. And one of the commonest things that happens with women with PCOS is uh, obesity. Having excess body weight is one of the factors. Irregular cycles, you may be missing a few cycles. That usually is the cause for the infertility. That is usually the cause for having a problem with getting pregnant. Then there could be problems of having excess hair growth, acne. Along with that, depression and anxiety have been found to be more in women with PCOS than in women without PCOS. And so what are the possible causes? I'll just briefly go over them. As you can see, the list is quite long. So sometimes is it because the stress of the condition itself? Are you really stressed out because you have a problem getting pregnant? Are you stressed out because of the excess hair growth? And sometimes people, just at random can tell you things which are very hurtful, but they don't intend to hurt you. However, is it because of that reason that it is, you are feeling more stressed and that's why you have more of anxiety and all these other problems? Is it a problem of body image? Yes, all these problems are possible. However, even in addition to all those things, there are some more factors, out of which there are some that you can control and some that you cannot control, and some that can be controlled under some conditions. So another possible factor is it that mental health challenges like depression, anxiety, and PCOS, do they have common genes or genetic pathway? Now, while we don't know a lot about that yet, a few studies done in women of European descent have shown that there are a few common genes between depression and PCOS. However, as you probably know, both these conditions are not because of one particular gene. It is a whole bunch of genes, and each gene may have a very small effect. So bottom line, there isn't a lot you can do, but sometimes you wonder whether, is this a personal shortcoming? So that is what I want to stress upon. It is not your personal shortcoming that you have issues of anxiety or depression or any of that. In fact, no mental health problem is a problem of personal shortcoming. There are reasons. Quite often we don't know all the reasons. Sometimes we do. Another major factor is higher levels of chronic inflammation. As you probably know, inflammation is like an ongoing process in the body, that is when we call it a chronic inflammation. And acute inflammation is when you have, let us say, you have a urinary infection or you have some little skin infection, which happens for a short span of time. So your body's immune system does need to function well for you to deal with acute infections. But when that infection becomes sort of chronic, like an ongoing, slow burning fire, that is not good. And higher inflammation levels have been associated with depression, with anxiety, with higher risk for heart disease, stroke, cancer, dementia, other mental health challenges. So bottom line, about 95% of diseases, chronic diseases, have been related to higher levels of inflammation. However, in relation to PCOS and depression, that is one of the common pathways. Another major factor is if you have excess body fat along with PCOS, the body fat is not like inert tissue lying around doing nothing. These fat the fat tissue secretes some chemicals which make your levels of inflammation higher. And the other factor is when you have higher inflammation, there is more difficulty in losing weight also. So it's kind of, it works both ways. And also for things like fertility, it matters that your inflammation levels remain low. Then, of course, you know that PCOS is a hormonal problem. So abnormal hormonal levels can also impact your mental health, because all these hormones, testosterone, estrogen, progesterone that your body makes, those are also called neurosteroids. Basically, it means that they have impact on how your brain functions. So therefore, when these levels of hormones are abnormal, as you know, one of the hormone levels that is not normal in PCOS is androgens, that is male hormones. So sometimes you may see that on a blood test, sometimes it may not be evident on a blood test, but basically my point is there are hormonal problems as well. Then comes anovulation, low progesterone, insulin resistance, birth control pills. So I'll talk about all of these very briefly. So the interesting thing is weight loss will improve all these conditions. Weight loss will reduce your inflammation, weight loss will improve your cycles, weight loss will improve your mood. However, the problem is, how do you lose weight? And that is not something I'm going to discuss on this particular video, but I have discussed that on another video before. And over a period of time, I will do more, I will record more videos on our PCOS Clarity channel. So chronic inflammation, number one, how will you know you have it? Now, there is a blood test available called HSCRP. If you do that, you can figure out if it is more than 1, we consider that to be high. Or if you do not do blood tests, if you have excess body fat, if you have belly fat, then you can sort of assume that you do have higher inflammation. So what are the ways we as functional medicine doctors look at reducing inflammation? Number one is anti-inflammatory food. Without going into details, I'll explain that. What are anti-inflammatory foods? So basically, what are pro-inflammatory foods? What are the foods that increase your levels of inflammation? And I'm sure you know that already. It is processed food, you know, all these, the junk food that many of you, have quite often. Then all the food that comes in boxes and bags, and most of them have been processed so much, they've gone through so much of modifications, that the actual real food is not, as nature made it, is no longer there. So anti-inflammatory food are food that as nature made them. So vegetables, and if you're non-vegetarian, you know, meat, fish, eggs, these kind of things, again, depending on your food sensitivity. So then vegetables, nuts, then oils that, oils that come from things that are naturally oily, not from processed seeds. All those are, then all those wonderful spices that, many of you use to spice up your food, all the wonderful flavors that come from, things like turmeric, that is haldi, or all the other different, a whole bunch of very, really nice spices are available there. So those, like things like pepper, those are the ones that are very, saffron, those are all anti-inflammatory food. Weight loss, as I said, ditch sugar. Now, sugar is not your friend, and sugar comes in many different forms. So sugar, honey, jaggery, maple syrup, agave syrup, they are all essentially sugar. So they are all, pro-inflammatory. They all cause inflammation. Time-restricted eating, eating within shortened intervals of time. So you have an eating window, you have a fasting window. And on our program, the MDS program, we use time-restricted eating very successfully, and we have helped a lot of people achieve weight loss and manage their PCOS a lot better. Then anovulation and low progesterone. So one of the problems, with PCOS is you do not ovulate every month. So every month in a normal menstrual cycle, an ova is supposed to be released from the ovary. And if you are planning a pregnancy, then when it meets a sperm, the sperm and the ova, they go through a fertilization process, and a baby and a pregnancy starts. So anovulation is a condition where your ovary is not producing ova. And in PCOS, that is one of the commonest problems. So the other thing that happens is if you're not ovulating, the hormone progesterone, which is extremely important for mood issues, is not produced in adequate quantities. So your menstrual cycle, there different levels of hormones are at, they peak and trough at different times, and that is why you get a cycle. So if you are not ovulating, then your progesterone level is going to be low. And this is the reason another major risk for PCOS is sometimes endometrial cancer. That means cancer of the uterine cavity, because the progesterone is not there to counter the effect of a lot of estrogen. So that is another problem. But the low progesterone can be related to the mood issues as well, because progesterone, as I said before, is a hormone that works on your brain and the nervous system. Then birth control pills are one of the commonest treatment modality for PCOS. And many women, and this doesn't happen with everybody, but many women have noticed that they have mood issues when they are on a birth control pill. Sometimes it can be with the dose, sometimes even at lower doses, people have had challenges. So is it possible that your treatment is causing more of mood issues? That is also something you need to look at. Then insulin resistance. So the underlying problem in PCOS is insulin resistance. Insulin resistance is a condition which very briefly I'm describing as a problem when your body doesn't have the ability to manage blood sugar levels, glucose levels as well as it should, because your hormone insulin doesn't function as well. Now, insulin levels, if you check in the blood, may be very high. It could be very low as well. I'm not going into those details, but how will you know if you have insulin resistance? Having PCOS itself suggests you have insulin resistance. If you have belly fat, if you have high triglycerides, if you have certain, if you've been told you have fatty liver, all those are indications that you have insulin resistance. So how can you deal with it? Number one is low carbohydrate food. So low carbohydrate food is all those food which, things like rice, roti, pizza, pasta, these are all high carbohydrate foods. Then all the food like, non-starchy vegetables. Starchy vegetables are things like potatoes. Those are again higher in carbohydrate. Again, sugar keeps coming back. And the other major thing is avoid snacking. Don't eat, 4 or 5 times a day. That again, I'm not explaining here, but that is one of the things that has helped a lot of people lose weight and manage their PCOS better. Sleep, not sleeping enough is actually very, very important. One of the major causes for a lot of people to gain weight, not just with PCOS, but PCOS, it can even complicate the problem even more. And the other big problem all of us have nowadays, that includes me as well, is we sit a lot because of the nature of our work now. So avoid continuous sitting. So these are all different ways you can look at reducing insulin resistance. Now, the fact is, if you have any questions, please feel free to email them to info@mdsprogram.com. However, what I want to say is, if you are on an antidepressant medication, if your doctor has prescribed something like that for you, do not stop your medication suddenly cold turkey. You can talk to your doctor. There is a way to taper down the medications. But my point is, just for every depression or anxiety problem, don't go looking for a pill. But if you are on one, don't stop it for sure without asking your doctor. And the other unfortunate fact is some of the antidepressant medications also make you gain weight. So it's kind of like a chicken and egg thing. Weight gain is something that you don't want, or you're struggling with it, and it's causing mental health issues. You're feeling depressed. You don't feel your best. You don't feel like, if you're a young girl, you don't feel like you're a young girl. You feel like you're old. You don't have enough energy left at the end of the day. So then you are put on an antidepressant medication, which again gets in the way of you losing weight. So bottom line, do not stop your medications without checking with your doctor. Same goes for your birth control pills. But it is possible that there are a lot of these other reasons that could impact your mental health as well. However, start with the things that you can control. Eat, food, that real food as nature made it. Start moving. Don't focus so much on, I know a lot of you are very bothered about how much exercise you're doing. Yes, if you are exercising, fantastic, but don't rely on only exercise to lose weight. Exercise is extremely important, but avoiding continuous sitting is also very important. So anti-inflammatory food, Look at your sleep. Are you sleeping well? Are you prioritizing your sleep? These are the ways you can reduce inflammation. And exercise, of course, has a wonderful benefit of, if you are just, if you're tracking your steps, if you just increase your daily step count from, let us say you are at 2,000 and you're increasing it to 3,000, some people have found 3,000 is not a lot of steps. So some people have found a lot of mental health benefits. In fact, there are studies showing that exercise sometimes works better than antidepressant medications for mild depression. But again, repeatedly, I'm saying, do not stop your medicines without, checking with your doctor. Do not stop anything by yourself. However, my point is, I want to give you a message of hope that there is a lot of other things that you can do besides, or maybe sometimes in addition to taking medications. So thank you, and bye now.